And as we start the meeting, I did send an email out and let you know that Lynn wouldn't be here, and just want to say thank you to Anna. Most of you know Anna. She's been at many of our meetings, and thank you for being here. And also, last meeting, I neglected to introduce our newest board member, Kendra. And so I want to introduce her today and just welcome to the board. Hopefully you'll find some good camaraderie here with your fellow board. And for our invocation today, Dave is going to give.
Now you asked me to do that. Okay.
Oh,
I am sure. Okay, let's pray. Lord, we do thank you for a beautiful sunny morning, and I pray for today for our agenda, that we would look at the things and help us to be making good decision, help us to be wise, with our voting. And I pray that you help us to meet as many needs as possible to the folks in our county. And we just pray that you would bless this meeting, and thank you for how you're going to help us. I pray in the name of Jesus. Amen.
Amen. Thank you. And please note our mission and vision statements as printed on our agenda today. And now we'll move into item 4, public comment. For those of you who are here or online who would like to comment, please state your name and where you are from. And also please address your comments to me as the board chair. And just refrain from addressing any individual board members or also any people who are in our audience. And finally, keep your comments 2-3 minutes, and Patricia will help me with timing. I'll notify you if your time has elapsed. Is there anyone in the room who would like to make a comment today? We have an actual podium in this room, so there you go.
Good morning. My name is Denise Newhouse, and I reside in Flint Township. I'm just here. That was my daughter calling on the phone, of course. I have to go to Pine Rest for a psych meeting this afternoon. But I'm calling because there's a new resident in our group home. He keeps harming her. She's been to the emergency room and the PCP. He does everything he can to hurt her. And the home tells me they're trying to keep her safe. So she is so dysregulated. She is so living in very fight or flight mode. And of course, that makes her behaviors and such. She doesn't get out of the home. She hasn't been to volunteer, and she can't go to volunteer right now because staff do not feel safe being less than 2-on-1 with this kid. And I've talked to CMH this week, and their solution, let's move her to another specialized group home in a different county. That's not my solution. My solution is I want to find a small little house and put staff in to create a program for her. We've tried 4 group homes now. None of them can meet her needs. She's fetal alcohol syndrome. Her birth mom drank her entire pregnancy and did crack, which caused her to have a prenatal stroke. The problem is I can find a cute little 2-bedroom, 1-bath house in Zealand to rent, but it's $12.95 a month. She will get $950 for all her expenses. Well, we can get food stamps, but how do we come up with that? And most people's solution, the parents can pay for it. We can't. We have 2 special needs kids, single income for the past 40 years. We are tired. We can't do it. So it's better to send her someplace else in who knows what county rather than in Ottawa County, which is the best place to live. I've lived here for almost 60 years and I love our county. Why? How am I supposed to come up with this money so that we can do this and then they can put caregivers to help her have a best life, to help her go out and be social? Because right now She doesn't leave the house. She doesn't do anything. She's just bored. There's nothing for her to do. That's why today I'm picking her up at 11. So when I sneak out early, so I can take her to lunch and spend some time, try to build up her emotional tank. And then we'll go to the psych appointment, and then I'll have to leave her there again and then get all these phone calls. Mom, I don't know what to do. Because yesterday I could hear him and her yelling, please get away from me. Leave me alone.
Your time.
I know.
Thank you so much.
Thank you very much.
Is there anyone else who would like to make a comment? Is there anyone online, Patricia, who might like? All right. Thank you.
Bonnie, may I make a comment a second? Is that out of line or not?
You may make the comment.
Okay, I just want to say, I do know Denise and I know her daughter. Man, no,
Okay.
I just want to say I know Denise and I know her daughter, and I don't know if any of us can put faces on some of the people that we hear, but I do know that face and I do know that person. And Denise, I am so sorry because I know the years of struggle that you have been through with your children. And I'm sorry that there's just not more appropriate, adequate housing for people like Michaela. We have to do better than that. Thanks for sharing.
Was there? Okay. Okay, well, there will be another opportunity near the end of the meeting. And then our consent items. Is there a motion to approve by consent, the agenda for today, February 23, and the minutes from our January board meeting?
I would actually like to pull an item off of consent. And I would like us to address the agenda for today separately.
Okay. Is there a motion to approve the meeting minutes from our January 22 meeting?
So moved. Second.
Okay, moved and supported. Is there any further discussion on those minutes? All in favor, please indicate by saying aye.
Aye.
And opposed, same sign. Thank you. And let's discuss the agenda. Do you have an amendment to the agenda?
Yes.
Okay, Sylvia, what would you like to amend?
I would like to amend under number 7, the millage fund savings. I would like to move that to be a discussion item instead of an item that we're voting on today. So I'm not sure where we would put that, or if we would just simply, because I don't see a discussion area on here. But I would just like it to be a discussion item instead of an action item.
At this point, Sylvia is suggesting can you make that in the form of a motion that we amend?
Yes. Yep. I would move that we would amend the agenda to make the millage fund savings to a discussion item instead of an action item.
Okay, it's been moved and seconded. Is there any further discussion on that before we vote?
Is this item coming as a recommendation from the millage steering committee?
Yes, it is.
Okay.
And Chris is going to briefly present it when we get to that place on our agenda. And then we will have a vote on it is the way that it would go. So right now, what Sylvia is saying is that.
I guess
not-
I guess what I'm asking is that we would not have a vote on it today, but that we would still hear the information today, and then that we would vote on it next month. So just that we would discuss it today and hold off on having a vote for approval so that we have time consider it. And then take it up again next month as an action item.
Okay. So that is what the, right now amending the agenda to take it off as an item voted on, move it to
So maybe we would put it,
in
maybe we
section
would,
9.
yeah. Yep.
Any further discussion? Okay. All in favor of making that change, please indicate by saying aye.
Aye.
And oppose, same sign.
Aye.
Aye. The motion carries.
Good morning. I have a second motion about the new business, the one to approve the February 24th service contracts as presented. And my motion is to change that from as presented, but separately. Make sure we vote when presented each of these contracts, we vote on them separately.
As a standard, you are asking that we do that, or are you just asking for this agenda because of some?
Going forward, would actually like that when we get a package of contracts, we actually address those separately. But immediately, for today, we only have 5.
Mhm.
And what I'd like us to consider them separately and vote on them separately.
And at this point, having not gone over them yet, you feel like you have enough information to know that you are going to want them voted on separately before they're presented?
As opposed to a package, yes, each one separately.
Okay, so could you make that in the form of a motion?
My motion is to amend the new business and suggested motion that says to approve the February 2024 service contracts as presented. Change that to approve the February 2024 service contracts separately. Yeah, be voted on separately. Yes.
Is there a second for that motion?
Second.
All right, it's been moved and seconded. Is there any further discussion? Just a clarification on my part. So when we're going through a rate change and we have multiple contracts with the same issue, are you, or should we just deal with this for today with the 5?
Well, let's deal with this today for the 5.
Okay, okay. Any further discussion or questions? All in favor, please indicate by saying aye.
Aye.
Opposed, same sign.
Aye.
And I'm going to say, I believe the motion carries. Patricia, did you? Okay. All right. And now I believe we do need a motion for approving the agenda with the changes, the 2 changes that we just made. Is there a motion?
So moved.
Second.
It's been moved and seconded. Is there any further discussion on the agenda? Kendra. All in favor, please indicate by saying aye.
Aye.
And opposed, same sign. Okay. Old business, is there any old business that we need to discuss? Then we'll move into new business, and Bill, would you like to present our service contracts at this time?
Good morning.
Good morning.
So we're here today to seek support on these 5 contracts and moving forward with those. So is it okay if I just do all 5 summaries, or do you want to?
Bill, I'm going to
Want me to
suggest
do
that you
one?
go ahead and do
Okay.
one.
Okay.
If we're
okay,
voting individually, there
Fantastic.
won't be any confusion.
Okay. Okay.
Thank you.
Good. So we have 5 contracts this month. And before we get into this a little bit, I just want to share earlier this week, Anna and myself met with Mr. Rockman to kind of go over the contracting process. And then we made a couple of changes to the documents that you received, so I just want to point those out to you.
Thank you.
The first one is on the actual board summary. On the primary funding source, historically, we would have LRE or the name of the grant. And the feedback that we received was that it would be more helpful to the public and to the board if we were just to spell out that it's a Medicaid or it's a grant to make it easier for people to understand. So that's the first change. And then the second change is in some of our one pagers where we are contracting with a home or multiple homes, that we start listing the location of the home. And so you'll see on some the Pine Rest and the Dignified Care ones, for example, we'll be listing the name of the home and then the general location. For HIPAA reasons, we want to, just say the city. So those are the two changes that we made. And these are a work in progress. So if you have any, thoughts or improvements that we can make on it, I'd be happy to talk to you guys about that and make those changes.
Thank you.
Okay, so the first one is with DA Blodgett. And currently DA Blodgett is providing services to some children that are placed in foster care in Kent County. And they requested that the rates for the ancillary services, psychiatric, case management, outpatient, be consistent with what they get from Network 180. So we made changes to those rates so then they'd be consistent. The second one is Dignified Care. They had a rate.
Bill,
Oh, yes.
Could we vote, please?
One at a time. Oh,
Yes, thank you. Is there a motion to approve the DA Blodgett contract as presented?
So moved.
Support. It's been moved and supported. Any further discussion on that contract?
Yeah, I have. Why are we, what's going on behind the new rates? What's driving that?
That is, well, in the bigger scheme of things, what we're really trying to do with the region is come up with regional rates. So we do that with SUD services currently. The autism services are currently those regional rates. And that's something that we're trying to move forward, to have consistent rates across the region. And it's very slow. It's been a very slow process. And this is one that we can do that most of the rates were not very much, and it made it consistent. So it's easier for billing, for the agency's billing, not to have to deal with different rates and whatnot. So the rationale is administrative savings, some administrative saving, but mostly just have it consistent across the region.
It feels like it would be more supportive in the sense that it doesn't matter like what LRE group, forgive me, CMH is actually providing the care, that you wouldn't accept patients based upon or consumers based upon who pays more as a perspective. Sorry,
Yeah.
clarity of thought.
Yeah, and I, correct me if I'm wrong, I would suspect there's probably a reason why we have foster children who need to be placed in Kent counties. Sometimes there are homes there that can provide a higher level of service. And so we don't want them to hesitate to take our children from Ottawa County when they need a placement in Kent.
Yes.
Okay.
Yeah. Yeah, so historically, DA Blodgett and Bethany Christian Services, been around for a long time. They have a lot of homes. So, folks from all over the state are being placed there. Yeah, I think we have either 5 or 7. I forget the number. That's how many we're talking about for this contract.
Okay.
Yeah.
And when you say regional rates, does that mean the LRE, for instance, or how, do you know how they're defining regions? I really like this concept.
Yeah, I was invited to a meeting last week with all the regions, a statewide meeting, and that's one thing that's on the agenda, particularly with inpatient, to try to come up with some type of a buying power consistency type thing with inpatient, because that's really hurting us.
I think it's a fantastic
Yeah.
idea.
Thank you. Any further discussion?
Yeah, one thing that just really jumps out here is on the program description about psychiatric evaluation. I'm just wondering how this fits in with the CMH being a CCBHC clinic. And, is there some sort of duplication of services or overlap? I mean, what's the relationship between CMH and its position as a clinic, as a CCBH clinic?
Yeah, I'm sorry, I'm not really able to speak to CCBHC.
This is not a CCBHC service, so we don't have any contract providers through that CCBHC program funding that we're receiving. So this is a Medicaid covered service.
Strictly Medicaid.
Yeah.
And
Right. It just leaps out psychiatric evaluation, which seems to be the focus of the CCBHC.
Yeah, this is part of their treatment package here, and this is a Medicaid covered service that we have utilized for years.
And sometimes with children in foster care, sometimes even the psychiatric evals they could even potentially be court ordered or, needed by the court in ensuring that the kids' needs are met. So it can be something even outside our control completely.
Any further discussion? All in favor, please indicate by saying aye.
Aye.
And opposed, same sign.
Those-
Okay. Then we'll go on to the next one. Yes.
Okay, the second one is with Dignified Care. This is an agency that provides foster residential homes for adults with IDD and mental illness. Couple of things going on here. They had a rate increase. So what happened is with some of the homes, we have different levels based on the person-centered plan. So if somebody needs 10 hours, for example, of CLS or personal care, the rate would be this much, and 20 hours, it would be this much. With some of these homes, we just had one rate, and we didn't have a rate based on the different levels. And the folks in the home are getting better, which is awesome. But the bad part was then the rate no longer supported the need. So we added the 4 levels of rates, so then the person could stay in their home, getting less services, the services that they need. So it's actually a little bit of a cost savings for us. And then the second one is there's a home, the Walker home. We were not contracting with them for this home. We decided, since we're making this change anyways, to add the home, so then it's available in our service array in case we need it. So that's what the change is in the contract for this one.
Okay.
So as I'm understanding it, you've established an acuity level basically for there are 4 levels of care. When I say acuity, I mean just kind of severity or need.
Yeah, so let me read that. Yeah, so yeah, based on the acuity, yeah, that's good. Thank you for saying that word. Yeah, we wanted to have the different levels, so then based on that person's need, we could fit it into the correct rate.
Yeah, adjust the reimbursement and then allow them to stay at the home.
Yeah,
Yeah.
that's it. Thank you.
And the Walker Home bill, was that just to build capacity? We don't have anyone in the wings to go there. It was
That's
just to
correct.
add in case it is needed.
Yeah, so now it'll be,
And
if
overflow.
it's approved, then we'll have that home as an option for us if we need it.
Is there a motion to approve the contract for Dignified Care as presented?
I have an additional question. About the levels of care, can you give some examples? Is that like more individuals might need one-on-one support in the home? Maybe assign somebody who's one-on-one, or can you illustrate with how that differs, variations in levels of care for each client?
Let me think of an example. I tend not to get into the person-centered planning stuff of things with HIPAA and all. So I'm thinking back to examples of, previous jobs. Is like, well, let's say we have somebody placed in a home and they need one-on-one staffing for the first 2 months, really close. Oh, this is a great example too. We have somebody that's eyes on 24/7 at Harbor House. one of the homes. And so they have increased staffing for that person where the other folks in the home don't have that eyes on requirement. So there's the different levels. We have different staffing based on that person's needs, so they don't elope or, yeah, that type of stuff. So hopefully that's a good enough example.
They actually hire extra staffing at this home to accommodate like a particular individual as opposed to working them into sort of a collective or group arrangement where everything they do at the group home is a group with the same, I guess, CLS worker or staff member. They're taking care of all these people simultaneously, but there may be individuals who need an additional staff member that's been budgeted to manage that one person individually.
Yeah, or folks might need more personal care. Oh, did I miss something? Oh, okay. Some folks might need more personal care, assistance with toileting, assistance with the bathrooms or whatnot than others. So there's a lot of factors that go into the thing, and that's all through the person-centered planning process.
Yeah, so there could be a chance that a new staff might need to come in, or they might have to bring on additional staffing to meet those needs if somebody needed one-on-one. These larger providers like this typically have staffing patterns that they're able to pull in staff to meet those needs. We evaluate what level of staffing people need who are placed in these settings. So it's not if somebody comes in with one-on-one that they're going to remain with that level of staffing the entire time. It could change depending upon their needs. So that's why we use those different levels so that we have the ability to, assess what somebody's need is for care in the placement to help maintain that placement, help them improve, and then we can adjust it accordingly.
And correct me if I'm wrong, but as you mentioned, the people that in these homes that receive these varied levels of care, they're improving. So the amount of CLS time they need is actually decreasing, which is part of why this rate needs to sort of modify itself. So
Yeah,
this
why we have the different
four-tier thing
levels. Yeah,
works.
so as people improve, maybe, they have a higher staffing pattern need, and they could move into a lower need, depending on their acuity.
Yeah. As they transition, that's a hard move.
Yeah.
Yeah.
Yep.
Any other questions for Bill before we get our motion on the table? Okay, is there a motion to approve the contract as presented?
So moved.
Support.
It's been moved and supported. Any further discussion?
Yeah. Just make sure I'm clear on what exactly with this new home are we paying for? Is it the personal care, CLS staff, or is it something else like home improvement?
So these are just for staffing if somebody was placed. So the new home that's being added, my understanding is we don't have somebody who's being placed in that home. It's adding to our panel of homes that we could place in if we needed to utilize it.
Would you consider that overflow?
Yeah.
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 like an overflow
Yeah.
bed. Okay.
So they're only getting paid if somebody's placed in the home and we've determined what level of care that individual needs.
Any further discussion? All in favor, please indicate by saying aye.
Aye.
And opposed, same sign. Thank you. Now the third
Okay.
contract, Pine Rest Christian Mental Health Services.
Okay, the next one is Pine Rest. Similar situation where we had Pine Rest reach out to us and let us know that they made an error in their calculations for the direct care wage pass-through. It didn't include overtime. So what this equates to is $2 more a day. It's not a big cost into the homes that we're using for specialized residential. So that's the first part. And then the second part is they have a Sequoia home, same situation. We did not have that on our provider panel right now. And we thought since we're bringing this to the board that we would add this home as a potential home for us in the future. So the Sequoia home will also be added to the allowables as a home that we can use. So that's the changes in this one.
Okay, thank you. Are there questions for Bill?
Everybody in this house, are they all going to be Ottawa County residents?
In each of the homes. Yeah, no, they won't, I'm sorry, I don't have numbers, how many folks we have in each of these homes right now, but it's pretty small. So, you know, for example, Freedom House, I believe, has 16 beds, and we might have 1 or 2 folks in there.
So I was wondering if all the residents there are going to be Ottawa County and wondering how much, if, you know, if they're not, maybe they're Kent County is, you know, how much is Network 180? This particular home.
Do you
So-
pay per resident?
Yeah, this is similar to the previous one where we're paying per resident as somebody moves in. So I don't know what they're in Sequoia House specifically, who has people placed there. I know Pine Rest is working with community mental health throughout the state. So there is probably the chance that they've got people from multiple locations throughout the state there. So this, we would only be providing funding if we had somebody placed in that home. At this moment, we don't have somebody placed in that home.
I guess that's one of my questions, to know if all the people in these homes are from Ottawa County or if they're from different counties.
Yeah, that's a great question. Like with these, you know, Pine Rest is working with folks throughout the state. So we're all trying to access open beds. So in this instance, they are not dedicated to Ottawa County. I think we've talked about some homes that do that, but for Pine Rest, they're not doing that with us.
So your financial category, is that kind of predictive based upon historical data?
Yeah,
Or
the
500,000
historical
versus
use.
historical
Yeah,
use.
and then looking at those levels of care that we utilize, so it's fitting it within that.
Okay, thank you.
And I think everything we know about housing, it makes sense to add Sequoia when we can and just put it as a part of the contract. So good forward thinking. Any other questions for Bill? Is there a motion to approve the Pine Rest Christian Mental Health Services contract as presented?
So moved.
Second.
Moved and seconded. Any further discussion among the board? All in favor, please indicate by saying aye.
Aye.
And opposed, same sign. Thank you. Okay, we're ready to move on to the next one.
Okay, so the 4th one is with contractor Dale Bird Cortez. And Dale Bird is a nutritionist that provides training for individuals and groups. And we receive funding through the Michigan Health Endowment Fund to pay for some additional trainings. So we're incorporating this into, it's a new contract because it's coming from a different funding pot. But we've worked with Dale for quite some time now.
Okay, any questions for Bill?
Just curious, like, how do like people know to access Dale Bird Cortez if they wanted health and wellness, you know, kind of opportunities,
Numbers.
selection,
So this will
healthy
be,
eating?
she'll be working directly with adult foster care homes. So
Okay.
that's how they'll get connected with Dale, is through their adult foster care home staffing.
Thanks.
Okay.
Communication, how do we get the word out?
Yeah,
Yeah.
for sure.
Yeah.
Bill, I see this is funded by a grant. And before I think I can even make an informed decision about voting on this, I would have to see the grant, because I think kind of knowledge that there are strings attached to a grant, and I'd like to see what the grant has actually said. Is that something you can provide? You know, send by an email or provide a link where that might be obtained.
So Bill doesn't manage the grants, so we can get you access to that grant so that you can look at it. It's one we've had for a couple of years and we're winding down on it. So it is slated to end on 9/30. So we're working to wind down that grant. So this was part of that. But I can send you the information on this grant specifically.
Thank you.
You're saying it's winding down, so this is not.
We won't be
You said it's a
renewing
new
this grant.
contract.
It was this was a one-time grant through the Michigan Health Endowment Fund. So the grant term ends on 9/30. So that's what I mean by winding down, is we're coming into the last several months of that grant.
Yeah, 'cause I see it's contract types is being presented for 6 months. That we're gonna be operating under this grant. I'm just wondering, how we're gonna be measuring that and how we're gonna reach a decision about whether or not we want to seek a new grant or extend it somehow.
In
going
this
forward.
grant, I don't know if we would seek a new grant. It depends on the Health Endowment Fund's funding opportunities. So this was special funding that they released, so it was a one-time grant that we applied for. Our grant manager will work with the foster care homes to track the data on what, Dale is doing and how many
What's in-
people that she's working with, yeah, and what those those outcomes are. I don't have the specifics for what's gonna be tracked, but I can get that for you.
It's the Michigan Health Endowment Fund, you said?
Yeah, yep. So like I said, we've had this grant, I believe it's about 2 years that we've been operating this grant. So we asked for an extension to finish expending the funds on it, and that's what this is getting us through.
So do you have like a dollar amount that's left on this? This is financial care category up to 50,000. I saw something in the contract where it was $7,500. Can you explain, what that means? How much money is left in this grant, or how much funding is left on this right now?
We could get you that information. I don't have it with me at this time on what the balance is left on the grant, but we can get that for you.
It says this full compensation for determined this agreement shall not exceed 7,500. And I was wondering if that was the actual number.
I don't think that's what's left in the grant. That's the cap for this service.
Okay.
Yeah, so this grant's paying for other things,
other
some
things as
gym memberships and different things too. So this is just one piece of it.
Any other questions for Bill? Oh, go
Yeah.
ahead, Stephen.
I guess maybe Billy can explain some of the terms here in the program description. I mean, it sounds very admirable. It's a little bit ambiguous. Do you happen to know, what they're doing as far as, with the healthy eating, menu preparation, what specific things or methodologies are being followed? Just to have a better, complete understanding of what the program is and how they're helping these people out with their healthy eating and menu prep and controlling food costs. We're dealing with the IDD population, so I'm assuming that this is working more closely with caregivers as opposed to the individuals, or maybe, it's both. I just don't know. I don't know if you have more information.
My understanding is that Dale's going to be working with both the providers at the adult foster care home and the people living in those homes. So she's coming in with a nutrition curriculum that she'll be utilizing with those homes. So that's what she
That's
does,
what she's
is
been
her
doing.
nutrition education. So she has a curriculum that she's creating.
So, I mean, it's just like a focus on a menu of just like fruits and vegetables and low-fat foods, or and like what kind of things are they driving at here with their menu?
I would have to connect with Dale on that. I don't have the specifics. I mean, what we're asking is for her to go in and work with the homes to provide information about healthy eating, maybe some recipes, teaching people how to cook, those different things. So, I mean, what we would expect is that it's health food that's being prepared. Whether that's vegetables or fruit, I think probably depends on her curriculum.
Explaining how that maybe clashes with recipient rights, as I understand it, whatever the individual wants to eat, you have to somewhat cater to that.
Yeah, and I don't think residents would be forced to participate in the program if they don't want to do that. I mean, this is something that we're bringing in to try and help give some more tools to the group homes and the people living there to be able to improve their health and wellness.
And Anna, again, correct me if I am wrong, but some people have part of their person-centered plan that they are working on their nutrition.
Yep.
So it might really help a person like that who
Yeah.
is living in adult foster care and working on that.
Yep.
And I appreciate that I see in here things like preparing texture modified foods, swallowing difficulties, because I mean, those are huge barriers for individuals who have those issues.
Yeah.
So I appreciate that she's going in and addressing those things as well. So And there are some individuals who definitely, I mean, they need their diets modified for behavioral reasons.
Mhm.
So, so anyways, I do see value to this.
Any other questions for Bill? Then is there a motion to approve this contract as presented?
So moved.
Support.
Been moved and supported. Any further discussion among the board? All in favor, please indicate by saying aye.
Aye.
And opposed, same sign.
No.
Now we'll move on to the last one.
Okay, last one is organic care. This is a new home in Muskegon County. And they reached out to us and our staff went and viewed the home and decided it would be a really good fit for this one particular individual. So we'd like to enter a contract with them to place this person in the home. One thing that I believe is Gretchen, I think you mentioned, was about the financial category. And basically what I did is we figured out the rate that we'll be paying and multiplied it times 365 and then saw what category that fit in, just so you know, the
No, I
kind of
appreciate
the
that.
logic behind that stuff. So, yeah, that's
So it sounds like we're doing things very proactively to find new beds availability, just,
We are
Uh,
always looking, yeah,
yeah.
yeah, and we're always trying to find places in Ottawa County or as close to Ottawa County as we can. I mean, that's ideally, that's where we would like everybody to be.
And do you know approximately, it's just a question that came to mind, how many new beds were kind of like, or you were opening up some capacity? I've been on the end of trying to place somebody. And do you have an idea of how many, even just like with these contracts that are new?
I don't know what the size of these homes are, but we could look into that and get
Yeah,
back to
just
you.
kind
Yeah,
of
we have
curious
to
as
see
we
what
look
new
at
beds we've added.
population that we serve and how you're improving, kind of bed capacity, that would be great.
Yeah, we're trying to use our avatar, some of our software, so then we can get that information like, hey, how many residential beds do we have? How many foster care beds do we have? We'd have to go through each contract and count. Now, so
Yeah, that'd be great.
we're
if we
figuring
could
out,
do it
hey,
for
we
you.
got,
Yeah.
so we can run some
Like a
reports.
spreadsheet in a
But I can
sense,
look
but
into that. We can get you some.
yeah, I
information
don't
on
want,
it.
thank you.
Thank you. Any other questions for Bill? Is there a motion to approve organic care contract as presented?
So moved.
Moved and supported. Any further discussion? All in favor, please indicate by saying aye.
Hi.
Aye.
And opposed, same sign. Thank
Thank
you,
you.
Bill, for your
Thank you, Bill.
presentation.
You're still here. Can I ask some
Oh.
follow-up questions. Is that okay?
Yes.
Well, Bill,
I don't-
I've got a few more questions for you.
Something dropped.
Yeah, I want to thank you and Anna for meeting with me the other day to take a look at the contracts that we looked at today in advance. And so it gave me some ideas about the one pagers. For instance, the agency overview. I think it might be helpful if we can include like a provider web link. So if anybody on the board wants to learn more about the organization itself, they can go right to a web link where they have like an about us page and have a better understanding of who we're working with. And then also provide to board members, if they like, a reminder of the boilerplate that's applicable for each one of these contracts. Will be boilerplates for Medicaid and there'll be boilerplates for non-Medicaid. And, that's part of the full contract that we're considering. And there may be various terms in those boilerplates that some members, their attention may be drawn to. And they'd like to get some more information ahead of time. For example, in the Medicaid boilerplate, you have attachments A through K. So for example, attachment A would be covered services, B reimbursement terms. So that might be of interest to somebody to consider or refresh their memory to have it committed to memory, the boilerplate. And then also contract terms are contained in the boilerplate, like so the Medicaid. That we could get access to financial records, Form 990s, credentialing and audits. Depending on what the contract is. Somebody on the board might want to see that information ahead of time. And then, that way, rather than every time sending us a voluminous packet of all of this in the boilerplate, we can individualize it and narrow it down. And then for the non-Medicaid also might be of interest. It has in there like insert the scope of work. So, that's going to be very from provider to provider. Maybe, they'd like to see what the scope of work is. That's supposed to be incorporated into the boilerplate or compensation amount or things like audit terms. If somebody wants to know about if they're something, maybe that grabs their attention. And then also provide a grant or link. We already mentioned this for each contract that's grant funded. So they have, well, I guess that somebody else is going to do that. But like to have the ability to request that ahead of time. Frankly, I wish I had requested that ahead of time for that one contract, but I think anytime we see a grant, we ought to have that, at least the opportunity to get it and review it ahead of time. And then there's suggestions that I have for those contracts.
And I'm wondering if maybe a follow-up meeting you met already and made the changes. And I think what Bill expressed at the beginning was it's living, breathing document. We can make changes or maybe make a link that people who needed to go to that boilerplate could. But maybe another meeting would be a good idea, Stephen.
Yeah, I'm open to that. I guess I'm putting this out here because as a board, I'd like to discuss if there's interest here in getting that information. I don't want to keep it all to myself. So that's why I guess I get the ball rolling and people are thinking about that, something you're interested in too.
I just had questions about, and it's only because you're the first group that uses MOUs that I've had an opportunity to ask this question of. I'm curious. So in the world that I come from, it's all contractual relationships and we don't use memorandums of understanding. And I suspect there's a good rationale, like in many departments here do.
Yeah.
When do you decide to choose memorandum of understanding versus a contract? I know we're working really hard to get super standardized contracts that flow nicely. Our legal department is.
Yeah. So what we do is look at if there's an exchange of funds. So typically memorandums of understanding that we use are ones that are solidifying more of a relationship. If, we're going to work together to coordinate services for the people that we serve that are alike. For the contracts, that's when we have an exchange of dollars. That's what we're looking at those being. So then we have, like Stephen, you were just referring to it. We have a Medicaid contract that we use. That's the boilerplate. And then we also have a service agreement, which is our non-Medicaid funded contract that we're using. That Medicaid contract is boilerplate from our region. So we use that. That contract is right now in place for 2 years, and then they'll review it next year, make updates to it. And then the service agreement that we use is our CMH contract that we're using with individual providers who are providing non-Medicaid funded services. So I think if you're interested in seeing those, the templates are all out on our website, and I can make sure we get you that link. And then there's some, more specifics when we get into those contracts with the group homes that Bill was just presenting on, that we have attachments that lay out what the rates are, what service expectations we have for those. So if there's interest in seeing those, we can get that to you. We don't want to overwhelm you with a lot of paperwork either. So
so it's just basically solidifying an agreement with an MOU, and there's no exchange of dollars, but it might talk about the dollars in the MOU, but it's not exchanged at that point. You wait till there's a contract.
Yeah, we would have a contract in place before we exchange dollars.
Okay. Thank you.
Yeah.
And that was it, Bill.
Okay.
You did a great job. Thank you.
Thank you.
Thank you. And I'd be happy to sit in on a meeting, Stephen, with Bill and you, if you would like to do that. I find the one pagers to be extremely helpful. I
too.
appreciated that a lot. So, are you comfortable moving forward?
Yeah, I just want to make, yeah, I mean, to have those one pagers may just fill out the contract for some people if they want to get a fuller understanding of what we're approving.
Yeah, and we can always provide that if you want it. So we can make that clear in those one pagers. And we'll include that website link as well. I think that's a good idea too, so that you guys could go out and see who these folks are that we're contracting.
Okay, thank you. Thank you.
Okay, thank you.
Thank you, Stephen, for the work on that. too. You're welcome. And now, Amy, we're ready to look at the financial statements, attachment B. Can you talk us through that?
Good morning.
Good morning.
All right, so we'll start with the mental health fund. This is reporting through period 4 of the fiscal year through the end of January. Mental health fund continues in a healthy position. You'll notice we're 28% spent of a budget of 33% at this time of the year. Revenues are consistent with budgeted, and expenses are on track. I don't know if anybody has specific questions about the mental health fund. We just completed our year-end financial status reporting to the state. We're working with the LRE to finalize that. All those submissions are due next week. But we're in a good position right now. And revenues and expenses are flowing well.
Can you clarify under revenues?
Mhm.
Explain to me what the category autism means. I'm assuming it had something to do with Medicaid funding, but it stands out there alone. So can you,
So, yeah, so autism, that is a form, it is a Medicaid funding, but it is funded in a separate manner. It's dollars specifically budgeted for autism services. So we report it separately. It comes into a different revenue stream. It's all paid out through the LRE, but we reconcile those autism dollars separately from our other Medicaid behavioral health services and Healthy Michigan, which is another Medicaid program that is budgeted and reconciled separately. So it's really like autism funds maybe would be more appropriate than just autism revenue.
but fundamentally it comes through Medicaid.
Correct.
Okay.
Yes. Mhm.
Amy, under the total Medicaid funding where we're seeing the yellow
Mhm.
indicator,
Mhm.
does that have anything to do with I'm don't have the term right now, but the Medicaid changes as a result of increase that we had during COVID, and now are we seeing that decrease already?
Reimbursement rates.
The bar at the bottom here,
Yes.
this is kind of a graph demonstrating what we have budgeted to what we've actually received, because the way that our revenues are distributed, it's on a monthly rolling basis based on actual encounter activity from. So it's just to kind of monitor and make sure that as we move forward, our encounter data is driving the revenue stream. So it's kind of a bar to represent that. We're
Thank you.
close right now, but some of that is due in part to the distribution schedule. January, we had a late payment and some of that. So normally we're even ahead of our budget because we'll get our revenues in a timely fashion, but some of that gets a little jostled with bank holidays and when things
So
hit
we
our books.
aren't really seeing anything on here that's giving us an indicator. I thought of the term Medicaid unwind.
The redeterminations.
Yes.
Well, one thing you'll note, if you look at expenses, we are, year to date, we're under what we've budgeted and we're trying to maintain that because of the potential risk of having a reduction in revenues. So, kind of all that plays together. Our service activity and our actual expenses kind of drive what we'll receive. So we're operating a little below what we had originally projected for a budget, but it's within where we are in actual activity. So yeah, we are seeing that, and they are, there's a lot of discussion about rates and about the drop off. We just had a meeting where they're projecting, up to 70% of certain populations that are going to remain. So that means we may lose 30% of those certain funding populations to that are no longer Medicaid eligible. So, yeah, but some of that we're operating to address those issues.
Do you look at previous fiscal year
Mhm.
ever? Okay,
Mhm.
I wonder if that would be helpful even
To include it.
to include it, and then we can see kind of, because you're, as far as 99.39% on target, that's great. But
Mhm.
you probably do you watch the gap to see kind of what that looks like?
Mhm. Yes, it's very, I mean,
Year-over-year.
well, and all of our operating considers like a 3-year average. And, obviously with the
Yeah.
public health emergency, that's kind of been an unusual average, but we can try to do something with at least last year and include that data. Some of it might be, I'm just trying to think of how the chart of accounts changed where we consolidated the funds, but I think we'll be fine. Just thinking about it is off the top of my head. Any other questions on the mental health fund? Nope. And then the millage fund, Fund 222, also in a healthy position. I don't know if there are specific questions on that. Actuals, budget to actuals, I'm sorry, actual to budgeted. We're a little over, but again, that's due to some of the one-time payments that we pay up front. So it smooths out as we get through the year on
Do you
the
ever call it
percentages.
reversal and accrual? That's what we,
Hmm?
reversal and accrual?
Yes, yeah. So, one thing of note, our revenues are in a healthy position. We were able to utilize some state general fund for services and preserve some of our millage in the fiscal year 23 budget. So that's, a good thing at this time with the uncertainty. We want to make sure that we're utilizing all of our resources. So that's one of the things we're wrapping up for our fiscal year 23.
I really don't mean to be an air hog right now, but question for you. I'm guessing this is diagnostically related and it might be something that Anna would want to enter in on too. So your autism services, it looks like just kind of lower reimbursement amounts or funding amounts versus DD. So is that just, it's per clinical diagnoses? Is it safe to say there are less people diagnosed with just straight autism?
So it's not that
DD?
so much. I don't know.
Why it's broken up that
This as the millage, it's a budget based on what you want to use that money for. It's unrestricted funding for the county. So there are programs that, especially in DD, we do a lot of support for specialized residential. So that has a larger budget. Some of the autism services, they have a healthy budget that matches what our service activities and those needs. So it's really, those are the expenses by population, but it's something that this board decides. So, that budget is set by your intentions more than the actual activity, although some of that, no, grants are pulled out. So I was gonna say some of it might be grant related as well, but those buckets that are by, actual program or team or service are budgeted based on this organization's intentions.
Needs determination.
Yeah. As a fund of unrestricted dollars that are used to support and bolster behavioral health in the county, it's kind of, it's not something that's mandated from this fund.
Okay.
So,
Thank you.
mhm.
Follow-up question on contractual services. I've been kind of
Mhm.
beating that drum for a while. So put together this chart here. And it was brought to my attention, at On Point Allegan, please, in the minutes for one of their meetings, they had broken it down into the program name, total cost of service, number of clients served, total minutes of service, and average cost per client. So wondering if that's something that in the future that'd be feasible for you to do when presenting the budgets on the contracted services, to break it down that way.
We have the data, QI keeps track of all of that. We can work on some of that. I think one of the challenges for us is we report out of our general ledger, which is the county's financial system. And so our encounter data is strictly financial when it flows into your financial records. So taking the data of actual service activity in our electronic health record, it gets translated to dollars here. So some of that we could marry, but a lot more of that, the reporting you're asking for, our QI team does report that. We could, explore bringing that together with the financials more.
As I think a lot of people probably be interested in knowing how many
Sure.
clients are actually being served.
Right.
We could look at, we present that utilization management
Yeah.
dashboard twice a year to you guys. And we could look at maybe incorporating some of that information into that dashboard too, to help cover some of those questions.
Yes. Gives you an opportunity for like a standardized reimbursement rate. Yeah,
Right. It all kind
Yeah.
of feeds together. So,
yeah,
yeah.
exactly.
Next page, there's a new graph, kind of based on a request. It didn't really print very well. Sorry about that. But I'm trying to demonstrate, direct run versus contracted services within our, service activities. So, the intention is to, contracted services are blue on the graph and all of our direct run services are orange, kind of sorted by different activity type. So I don't know if there are any specific questions or if this is useful information or what you were looking for, or if there's anything different to address, but just wanted to be able to present the information in different manners.
Yeah, it's useful. I just told you, looking forward to break it down a little bit more detail.
Mm-hmm.
They did.
Yeah,
Yeah.
like if something like this data could include more encounter detail, like the counts and the client served.
But this does really give us a picture of
Right.
how many services are contracted versus the, what is directly done by the agency itself. Appreciate that. Thank you.
And continued with the same graphs, monthly graphs of the year-to-date expenses by primary program, both as a bar chart and a pie chart, kind of seeing where the money goes. And then the report on the graph on where funding, our funding breakdown for all of our operations. Budget to actual.
So in your funding type grant, you have Medicaid, and maybe I just can't see it because it's small, but does that include the autism Medicaid as
Yes,
well?
yeah,
Okay.
so that includes Healthy Michigan, includes. Sorry. Yeah, Healthy, all of our autism funding, yes.
Okay.
And maybe I could break that down
Yeah,
as well,
that'd
it
be
might be,
helpful.
yeah.
Yep, thank you.
All right. Any further questions for Amy? All right. Thank you, Amy. Thank you. Is there a motion to approve the fiscal year 2024 January financial statements as presented?
So moved.
And support.
Moved and supported, and Any further discussion among our board? All in favor, please indicate by saying aye.
Aye.
And opposed, same sign. Thank you. Now we'll skip the millage fund savings. We'll move on to the revised 2024 board meeting schedule. It's our attachment C. And this meeting schedule is based on the discussion that we had at our after our January meeting. And so we're just bringing this forward now because our schedule needs to be approved at a meeting. My understanding after, a lot of trying to get a time that works for a lot of busy people. This is the best that we can do. I did reach out to Lucy and she said typically she would be able to make it. She may be able to come in today a little bit late, she said, but it was a work conflict. Terry had a personal conflict, but he said he can make it too. So based on that, first, I'm just looking for a motion to approve the revised meeting schedule as presented in attachment C.
So moved.
Moved and supported. Any further discussion on our meeting schedule? All in favor, please indicate by saying aye.
Aye.
And opposed, same sign. Thank you. Now we're on item 8, and Anna's going to do a summary of a report, kind of following
Yeah,
up on some of the things we
It won't
talked
be
about.
as thorough of a report as Lynn does for you guys, so this is just your deputy director's report today. I just wanted to tell you a few brief things and kind of give some updates on things that she had talked about last month. So for the state, through the Michigan Department of Health and Human Services, we're continuing to prepare for that Michicans implementation. So that's a standardized assessment for children that'll be used in the development of the person-centered plan. We are working to incorporate that assessment into our medical record and then get our staff trained, hopefully in the next several months here, so that we can go live with that on October 1. So we are required to use that assessment starting October 1st. Everybody in the state will be using it. Then from the regional level, the Lakeshore Regional Entity, Lynn last month talked about that we were going to have a site visit. Our annual audit happened. So that happened February 5th through the 9th. We will be receiving the draft results pretty soon. So once we have those final results, then we'll make sure we bring it back to you guys to share those. They performed a desk audit of our policies, best practices, and procedures to ensure compliance with our contractual obligations with them. Overall, I think it went really well. Our team was on a Teams meeting with the region for the entire week and gathering proofs and documents that they needed, and it seemed to go really well. Then at Community Mental Health, as you guys are well aware, we continue to have vacant positions. So we've tried to increase our recruiting efforts, working with the Human Resources Department. We've developed several recruitment videos that are short spotlights on why it's awesome to work at Community Mental Health and what the benefits are of the people that we work with, along with the staff that we have. So we're going to continue those efforts. We've participated in the last week in a couple job fairs. One was in person and one was virtual, and we plan to continue doing that as we're able to. Hopefully we get some more master's level clinicians out of that. Really, everybody, I think, is fighting for those positions throughout the state. And then the other item of info that I just wanted to cover is that the Michigan Department of Health and Human Services requires us to complete every 2 years a stakeholder survey. That stakeholder survey seeks input from 7 key community partners, which include the justice system, school systems, primary health care, Michigan Department of Human Services, private mental health and substance use provider organizations, public health, and consumers or advocate organizations. So that survey was shared on our social media accounts. It was also shared with key community partners and our provider network. So we'll be bringing survey results to the Millage Steering Committee We're planning on next week, Friday, but this is a narrative survey. So it asks 3 questions. And it's all narrative responses. So our staff are gonna work busily next week to try and get that ready to present to the steering committee, and then Lynn will bring it to you guys at a future. And that was all I have.
Great. Thank you, Anna. Anyone have any questions for Anna?
A couple questions. You were talking about recruitment.
Yeah.
Efforts. Do you know how many open positions you have right now?
I believe we have 8,
8?
so it's fewer.
Mhm.
Yeah.
It's
We're
14?
steady at like 14. So yeah, we have hired a few positions.
Okay. And just because I don't know this, does HR track it for you? Like how long those positions have
Yes.
been open?
Yeah.
Okay.
Yeah.
And then you said they're master's level primarily?
Yeah, we have a
Yeah.
variety that are open. The ones that we have struggled to fill are master's level positions, nursing positions, and prescriber positions. The more specialized the position, the harder it has been for us to fill.
You have a case manager aide position or something
Yeah.
like that? What is that?
That's a bachelor's level position providing service coordination for
Okay.
the people that we serve.
Okay,
Yeah.
so it's BSW.
Yeah. Yep.
Okay.
Yep.
Sorry about this community needs survey. It's going to be presented to the steering committee in a narrative form. And I have to tell you, I can't make it to that meeting that day because of conflicts. But is that something that could be presented to the whole board?
Yeah, Lynn, I think we'll bring that to a future meeting. So we'll have the results. We're going to compile those. Yep. And that's what's being reviewed at the steering committee is the compilation of those.
All right. Thank you, Anna.
Yeah.
And now we'll move on to item number 9, general information, comments and meetings attended. I'd like to start out with Chris, maybe giving us a little bit of a summary of the recommendation of the steering committee and where you landed on that.
Sure. So as tasked by this board, the millage steering committee began meeting in September, working kind of like wonkily around the holidays, but we've been meeting pretty consistently twice a month since then, beginning with an assessment of the intention being to assess all programming funded by the millage, starting with the social rec programming, which we are almost completed with. During the course of our discussions, it has sort of come to, I mean, the discussions are wide ranging just based on the universe that mental health occupies, and the idea of how to best utilize the millage funds. Due to a higher tax base, there is a surplus at this time. And it was suggested to bring to the board the notion of releasing $1 million of that excess funds that isn't currently committed to fund new initiatives, totally new initiatives that might be not outside of the scope of the RFP, but we haven't released an RFP for a minute. This would also, it would be new, but it would also be new/same. So for example, if a new social rec program wanted to stand itself up, we would entertain those RFPs as well, to increase the capacity of that part of what we do. A number of other things have been discussed. Funding would be for 1 year, with the idea of giving an initiative a secure jumping off point so that they can pursue their own funding if their concept works. So that, in short, is sort of where it's at right now. We're going to take what comes back from the stakeholder assessment, as well as what shows up in the strategic plan, as far as and along with, just things that have come up in our conversations as a steering committee, to sort of assess what our priority goals are going to be. And from there, the goal would be to let the community know about the RFP and then begin the process of evaluating those programs based on merit to those goals.
All right, thank you for that summary. Anyone have questions? I know there are others who have been sitting on the steering committee as well. the millage steering committee and anything else that you have to add to it that would help us as a board understand this proposal.
Yeah, it was my intention at the last meeting. I wanted to get this in front of the board ahead of time. Try to start considering this before, we just had it laid on our laps and pass it, we have a motion and vote on it. Because the things that, really jump out here, and I think are important for us to consider and talk about is it is $1 million in taxpayers' money. And I think a lot of this needs survey, the focus is on particular stakeholders. And I don't know if it really is reflecting the whole county, all the residents, is, what do they want us to do with this excess millage money? And I don't think we're getting enough feedback from them. It's more like we're getting feedback from, I would call them the special interest groups with CMH. And then the other thing that jumps out that I want, this board to start considering, and I'm relieved that we're doing this discussion actually, as opposed to doing the vote. Talk more about what those projects are going to be. To whom are we going to be sending these RFPs? And I understand again, this is based on the needs survey and strategic plan. That this survey is required by the state. And I think one of the things we need to understand is maybe we need to all take a look at the guidelines for the survey that have been issued by the state. So we're in full understanding of what's driving this and how it's being drafted and presented. I don't know that that's that clear to everybody on the board. And I think we need to go back and revisit the strategic plan as well. I noticed that for 2024, a couple of the primary goals, 1 and 4, is focus on the CCBHC. And I've said this before, I don't know that everybody here on this board fully knows what that involves. I mean, every time we have these meetings, I see CCBHC always comes to mind, and it's like, I don't know how much of it is operating in a parallel universe or how wet it is to the CMH. It's hard to distinguish at times. That's like when we had the contracts came up, I see these things about psychiatric care and crisis services, and then automatically it jumps to mind, well, this sounds a lot like CCBHC. I mean, we're duplicating, we're overlapping. What's the distinction here? What's going on? Because I know it's the CCBHC is driving, I think, where the CMH is going to be going in the future. And I like to have a clear picture of, that destination. And I think we need to understand the CCBHC handbook, because that is driving a lot of the initiatives that CMH is going to be doing. And I have to say, I don't know if a lot of that reflects the community. I guess this is going to be, I don't know how this statement will sound, but there's a lot of the CCBHC is directing a lot of these social justice themes. And I don't know that reflects the majority of the county. And you can just read it right in the handbook. And I think we need to sit down and study this handbook. I'm still waiting for the informational meeting so we can sit down and talk about that. And then I see, we've got this cultural competency plan that was directed by the CCBHC, which we haven't talked about. Again, it's just, just crawling with these social justice themes. And frankly, I think this competency plan is going to open up this county to lawsuits for affirmative action discrimination, which in the context of college admissions has already been ruled unconstitutional by the Supreme Court. And I know that this is all being driven from Michigan Department of Health and Human Services as well. And I imagine, I suppose they're comfortable with it, but when I'm looking at it, I'm just saying, why are we opening the gate to this? And so I think there's a lot we need to more fully understand about the foundations of this survey and the CCBHC before we can really go forward. When it gets back to, these projects and RFPs based on the survey and the guidelines that have been they're built on.
Are you saying that the survey that was utilized then for this project was based on something from the CCBHC? I'm not sure I'm following you on that part.
Yeah, let me
I
see.
can
So-
speak to the survey real quick. So the survey is required by the Michigan Department of Health and Human Services as
Mhm.
part of Community Mental Health Annual Needs Assessment. So it's not part of CCBHC. It's our contractual obligation with the state
Okay,
that we need to do. So they give us 3 questions that we have to ask, and they tell us specifically who we need to send it to. My understanding from the steering committee, and Chris, correct me if I'm wrong, was that that was one of the pieces we were gonna look at
To use.
to use, to help see where are we hearing that there are needs in the community. That's not the sole piece that will be used
okay.
to determine the
Correct.
steering committee really, like Chris highlighted, was gonna be looking at multiple things to determine which programs that or which proposals that are returned through that RFP process are the ones that would come back to the board for potential moving forward as a funded agency.
That's correct. I mean, again, to sort of, first and foremost in the steering committee's mind has always been the mandate that the voters put forward when they approved the millage, which was it's there to fill gaps. It's there to provide service in places where there isn't funding. So that is obviously the prime mover of what this additional funding would be used for. We're not targeting RFPs to individual organizations. And I don't want to get too deeply into some of the brainstorming that has occurred as far as, things that this one-time opportunity could be used for. But they address the things that we discuss about, the things that we talk about every meeting. They discuss housing. They discuss service providers in county. They discuss those things that we see through public comment and through our own, journey through being board members as being the core issues that are affecting our consumers in this county. So it's not targeted out. The RFP is not in. We're not going to send it to specific organizations and say, please fill this out. It will be community wide to facilitate the job that the millage was set up to do. Now, if the community obviously will be going out because a renewal of that millage is coming up, we will be assessing, I assume, the community to see if that's still what they want to do. But at this point, this $1 million would be used to fulfill that mission.
So I have to say that with CCBHC, I have some of the same concerns Stephen does, because it looks like it, and I'll make it relate to the millage, because I think we're saying it's a gap, filler. That's what the intended purpose was, gap in services in our community. CCBHC seems to be, it's like we're getting more and more funding, and I know you can't control that piece of it. But it seems to be a larger funding source, and it's directed primarily to SUD and mental illness, and mainly the mild to moderate, which that's not where like our, kind of our severe mental illness or IDD population generally fits into. And our millage dollars, as you look at that, are really kind of being directed to that population more. And so, it's like, as we look at a surplus that exists here, and $1 million surplus, we're hearing there are housing needs, for instance, and I'm really happy to hear that we're talking about that. But I don't ever want to treat those millage dollars like we've got this surplus, I guess, even though it might exist, but we definitely have use for it. We did task the group to look at social rec in particular, but also, other issues. I'm hoping, as we started to talk about this regional rate, even today, which I think is an excellent idea, that, we could have a common definition of what social rec is, that it's an understanding for all the programs that provide it, because there does seem to be a little difference in how those services are provided. define what a visit is. We're talking about that right now. You know, is that 1 to 4 hours? Is that 5 to 8 hours? How do we reimburse that? You know, and how, you know, clinical support services? What's needed for that individual? Again, we're moving to an acuity system as well. And I'm hearing you do that. It's really exciting to hear. But like standardize our rate based on the acuity and their visit. And then ideally, let the community decide, let the people decide. You can contract with these different social rec programs, but let the community decide. So it doesn't eliminate Momentum Center. If that's something that, you know, people want to use, they get to choose. But if they would prefer to go to ICUS instead, let them decide to do that. And, you know, you could do kind of a work session, a work group with the people who currently provide social rec and maybe some outside providers that might be interested, stimulated by some additional funding that's available, you know, to also provide social rec services. I see this as not just supply and demand, but let capitalism and let people's choice reign. Opportunity. And I guess that's kind of what I was looking at, you know, from the millage steering committee.
Sure.
Maybe I've
and-
just already defined, you know, it's like I'm a project manager kind of person. You know.
Sure, and to speak to your points, all of those, we are coming up with measurable metrics, which, again, this kind of speaks back to the origin of the millage, and how it was stood up versus the need to kind of like create, trackable, measurable pieces that we can then take back to the community to say, this is what this millage does, and this is what it did. So, the things you're speaking of as far as assessment, as far as, you know, a cost per type of idea, those have been discussed in our group, and those are metrics that we are working towards creating. I mean, they're very, the frame is just completed now. We don't necessarily have a lot inside given our meeting schedule. But those are things that we're working on. At this point, I don't think the social rec programs are determined exclusively by geography. One of the things, and when I did mention, I brought out social rec and specifically is that, yes, you know, within this is the concept of increasing social rec opportunities to create exactly the type of multiple choice our consumers and our parents of consumers would like to have. The geography of the county hasn't necessarily changed, but population clustering has. And we recognized, I believe, at the beginning of the millage that the 4 quadrant section was the best solution at that time. But now with, you know, having gone down the road and sort of having those programs stood up, the concept of, you know, perhaps localizing some services in the middle of the county and other areas of the county where there's need, this opens up that opportunity for those providers and those programs to stand one up without fear of trying to create the funding at the same time. They can stand the program up, know that it's funded, come up with some measurables to kind of create funding going forward. And the surplus is based, you know, it's not a rolling surplus, unfortunately. That would be way too cool. It is a one-time based off of the tax base in the county. So
I think that tax base is going to change, Chris. You know, honestly, I think we're going to see an increase in what's available in our millage.
As a committee, we didn't want to sort of like extrapolate an economic future. So, I mean, that would be great to talk about. And, you know, that type of data as far as economic will probably make itself known before the renewal committee starts its work. And at that point, that can probably be folded into that process that goes to the county citizens for their consideration.
I would just say, I kind of feel like a lot of authority has been given to this steering committee. I was a little surprised to see $1 million item come on to our agenda today, coming out of the steering committee. It was completely unexpected. So I personally think that we need to retain more authority as a CMH board over what's going on with the millage funds. I would personally like to see any RFP language come before this board for approval prior to being used. I also would want this board to be able to see any and all projects that come in as submissions in response to such an RFP. I don't think that a subcommittee should be making disqualifying decisions outside of public view on projects, which would eliminate possibilities for community use. I think that kind of oversight and visibility, we owe it to the public for that to happen here. And so I just think we need to be really careful about too much happening on a subcommittee basis when that authority should be happening here at this board. And so I think some strategic thinking, and bringing ideas is appropriate from a steering committee. But utilizing authority that restricts possibilities and is, requesting to use up like a full $1 million without really good input from this board. I just don't think that's quite appropriate. So I think we need to be careful what we're doing with that steering committee. I personally would like to see this board have a little more input on what's going on with the millage.
That was always going to be the intention. I might have not been clear. The committee would, and I believe by the rules that guide this organization, the steering committee couldn't vote to spend that money anyway. That's a board process. Similarly, the approval was would release us to develop an RFP that would then come to the board for review, that would then be released, as all RFPs are, through, the county, and then come back, and we would, as a board, assess those. We're only coming up with sort of the metrics. We're not picking winners and losers. We're not trying to, that has never been part of the discussion. It has always been based on our mandate to look at this millage, starting with social rec, and then come back to the board with what, with a form to use currently, and then going into discussing whether we're going to try and renew this, go to the Board of Commissioners to discuss renewal of this millage. That piece, we have at no point discussed whether we have any authority. Our authority is entirely based on seeking information from and data from current millage recipients for our to go over and coming up with a package that we bring to the board. I'm sorry if there was any confusion there.
No, and that's fine. We have just seen things like, for instance, with the ARPA process where there has been elimination of options and very significant decisions made in subcommittees, and that's not CMH. But I think that that's always something that we have to be careful of when we're looking at subcommittees, that we're careful about process and keeping things in the public eye.
Right. Our mandate when the board voted to do this was solely review and return. It had nothing to do with doing any fiduciary stuff. So that's never been part of what this came up out of our discussions. And as this is here right now. We have received through public comment and through discussion as a board, a variety of different things that, ideas that have come up in situations or in areas of need. And this surplus represented an opportunity to kind of flex a little bit and see if within the larger mental health community and provider network, if there was the possibility of sort of creating some of that change that we see that is needed. And so that it grew out of that assessment process. But it is still just assessment, and we gather data and return to the board because it's the board's decision.
So would it be possible if we're looking at some point being asked to vote on this, would it be possible to be brought actual language of what the RFP would look like?
course.
What you're looking for?
Of course, yeah. Our draft language would, I assume, have to be approved by the board. So yeah, I mean, we're not doing anything that's nearly that ground shaking.
So Chris, today, what you were coming to the board for was the approval to move forward to develop
Correct. I
the
mean,
RFP, and then that would come
part of it,
back.
yeah, because part of it is streamlining. We're trying to accommodate sort of what the board's requests or desires were as far as the timeline of this. And so, you know, if this isn't something that the board wants to work on, we'll just put it off to the side and work on the other stuff that, because there is, we are on a timeline. We understand that. So we're trying to be as expeditious as we can be to get these things done.
Sylvia, if I'm hearing you correctly, you're saying you'd like to see some draft RFP language to come to this board.
Right, like I wouldn't be comfortable voting to just say go forth and, you know,
Right.
and issue RFPs. I would rather see, you know, here's the kind of RFP, or even give us a couple options, you know, of different kinds of things we'd like to issue an RFP for. So we're making, you know.
So Lynn and I can work with the steering committee then to develop the draft language for the RFP. And then I think what Chris was alluding to is, you know, once that language was approved by the full board, then we can go through the county's process for releasing the RFP.
Mhm.
So we still have to follow the county rules. to release it.
Yeah.
It
But yeah.
almost sounds like a grant fund to me, is what
Yeah.
it sounds like. It would be nice to hear, important to hear what categories would qualify
Yeah.
for
Mhm.
what it is you're thinking of doing with these, what projects would qualify. And then also, how would this get communicated too? So we do have an even-handedness.
Yeah, and the RFP process through the county is very formalized. And so we draft the RFP language, we give it to our purchasing department. They put it into their required format for a RFP, and they send it out through their networks. So it's a little separate from us. We don't release RFPs right out of our office. We have to go through the purchasing department to do that.
So housing might be one of the project lines
Mhm.
that you're looking at.
That was
Here.
one that the steering committee had suggested. My recollection of the conversations where we were looking at things pretty broadly right now to also see what the community would come back with as a proposal for a one-time project, to try and get at, what is it the community is really wanting for these funds to be utilized.
Sylvia, let me follow up on your question about the CCBHC. My understanding when this motion was brought to this board today, that it was to be guided by the community needs survey and the 2024 strategic plans. And that strategic plan, goals 1 and 4, focus on the CCBHC. So that's why I was coming around to that it's important for us in connection with this suggested motion that we have a better understanding of the CCBHC is. And follow up what Gretchen said, as far as the social rec, I think it's very important that all of this go through the person-centered process. And that it shouldn't be basically, we have 4 centers you can choose from. And it really needs to be opening it up to a lot of different organizations out there that would like to offer this service. And then ultimately it comes down to the individual where they want to participate and have greater choice.
Under contract for payment.
Yeah, exactly.
So I think we've had some great discussion here. I appreciate everybody's comments today. And Chris, thank you for your summary. In order to the next step on this, I guess we're just going back to the millage committee with the information that was discussed today. And I think we're all kind of open to looking at what we can do to meet the needs of the gap places that have been identified. So I think, are you feeling like you have what you need to?
Oh, sure.
back to
Yeah,
Kim.
I'm sure, but yeah.
Okay,
And just listening to both Gretchen, Sylvia, because Steve and Kirsten and I sit on that committee, it almost feels like we could take a whole board meeting here,
Mhm.
just talking about what we talk about at the millage steering committee, because there is so much. And maybe just to Sylvia's point, maybe just in the way that this motion was written,
Mhm.
it's pretty like we're giving complete authority to Lynn to do
Yes.
that. And it's not that we don't trust her, that's not that, but that was the way this was written sounds that way. So I can appreciate that comment a lot. And it's right, we're just a subcommittee. I don't mean just, but we're a
Right.
subcommittee, right? And so
Right.
Christian's recapped everything well, what we've been talking about the last couple months at the millage review, but there's so much. And I wish there were some more moms besides Denise and Rosalie sitting out there, because I do live in these trenches every day, right? I work with 200 families or more every day. I live with it. My own son, who's 32 years old, who can't drive, who all these pieces, right? If you were to invite parents to come into our millage review thing, they'll tell you what we need. We need transportation because they can't get to those places. We need housing because they don't have a place to go. I know her daughter, she doesn't fit Compassionate Ministries, but she needs a place to be. So the needs for that millage review steering committee are so ginormous. I don't even know how to bring it all down to an RFP.
Maybe funnel by categories?
Yeah.
Yeah.
And I even wonder sometimes if we shouldn't like look at family scholarships, because every family is so different.
Yeah.
And would those millage dollars, be useful to give scholarships to the families to meet those needs that we don't really know how to create a specific program for?
Again, that's gap funding, and, assistant for respite support. Everything that has come up, over our time here has been thrown into the mix. I don't think anything is really off limits. And that was the point of, asking for that release, was it really widens out the scope, because what was defined as the gap when the millage was approved has changed. And so that requires different language and a different lens to look at it through.
Yeah, and
We
let it
talked
be
about that, like when it started in 2016 or whatever, it just changed drastically. So maybe we're not having so much attention put on social rec, but we got other things we got to deal with now.
right. We don't want the millage to go away. We know the needs have evolved since 2016. But we want to make sure that as a board, those funds are being used responsibly and meeting the needs of our community.
And the transparency to the community in terms of what we're using them for. And does it line up with what we asked for the millage for?
Exactly.
So,
Exactly.
yes, good discussion.
Mhm.
Kind of along the same lines, I know I heard a lot of discussion about, needing to know more about certain things. And we had done a doodle poll about the topics that we wanted more information on as a board. I think housing was the first one.
Yeah.
CCBHC was in there too, I know. And so I think it's been challenging, to say the least, for Patricia to come up with a date that works for us. And again, we are looking at a lot of busy people. So I think what we need to do is, at this point, Patricia, your doodle poll has not yielded an outcome of a day that will work for us. Sorry. Okay.
Will be coming back out soon.
Clearly it's not a good rule for establishing because
We need to
Would
look
this,
at
would this time work on non-meeting days?
on another Friday.
Yeah.
So I
I
think
mean-
that's where we just wanted to put it out for people to discuss with each
Yeah.
other while most of us are here.
So that's cool, but our village review committee meetings are Friday mornings as well.
Oh,
And I
right.
love hanging out with y'all,
Uh-huh.
but,
But every Friday is a bit much. Yeah.
Yes. thanks for that.
What about right after this meeting?
That would be a possibility. Yeah, we're already here.
For an informational, we're here, we're together. Is that a possibility? I know it's hard for staff who are presenting because we can't say an exact time.
I think we could make that work though.
You think you could?
Yeah.
Is there any other idea? I guess it's just really hard to come up with
Yeah.
times for all of us.
I guess I thought, and I'm down for that, of course. I thought the reason we split them out was because it had a tendency of tacking on another hour to the meetings where we're kind of like keeping.
Yeah, the thing that we would do that might look a little different from that would be, we would clearly end the meeting.
Okay, no, that
And
makes
then
sense. Yeah,
it would
sure.
be just our informative, discussion meeting where someone would present information that we want to learn. Should we try that as a first one? Let's get one going for the housing one. And then maybe from there, we'll come up with something else that works for our schedule.
We're all in agreement.
sounds
Let's get moving with that because yes, I understand when Lynn was saying, we're gonna start out with our first information about the housing.
Mhm,
And then it sounded like she was gonna consider, then we could do the CCBH soon.
mhm, mhm.
And I'd like to at least keep it in that order.
Yes. Sounds great. Okay, we've got one. Anything else? Does anyone have anything else for general information, comments, or meetings attended? Okay, I appreciate everybody's discussion today. And now we'll move to number 10, our second opportunity for public comment.
My name's Julie Norkley. I'm from Grand Haven. Julie Norkley. I really enjoyed the discussion you guys all had today. I thought it was really productive. I want to encourage the board members that are seeking understanding before voting on different initiatives. I think Steve brought up the one about the grant funding and asked some questions. And I think that's really good because you're a board and it's your job to provide oversight, right? And if you don't understand what's included in the grant, what the strings are, how it works, you can't make an informed decision. So seeking understanding, I think, is so important. As far as the needs go, you guys were discussing needs a lot, and I've heard other people talk about housing. I mean, you just think about any human being in general, right? We need food, water, shelter, and then we need, transportation, safety, and then social stuff. So, I mean, it's really easy if you look at any person to put things in a general need order. And then I'm not fully sure on the mission of the CMH, but you've talked a lot about mild to moderate. And as somebody from the community, I think if I want to make sure everybody's taken care of, the first people that need to be taken care of are the destitute, the ones that can't take care of themselves. The mild to moderate, right? They've got some resources, they've got a fighting chance, they can do some things on their own, whereas the destitute cannot. So put it when just something to consider, putting priorities in order. And then one other thing you guys were talking about was your information meeting with the whole board. And I don't know if that's going to be open to the public or not, but if you've got the whole board in a room that's closed to the public, I think there's some risk of violating Open Meetings Act.
Oh, it's not. It's just training.
Is my time up? Is that what you're? Oh, and then back to the grant. Sorry, I'm a little scattered. Back to the grants and the one about the health endowment fund providing meals and it's a grant, it's temporary. So my question is it necessary? Is it something that you would want to continue after it ends? Is it like really a valuable program? Or is it something that we don't really need at all? Because if it's a grant, without knowing enough information about it, I think, so I'm happy that, some people are talking about getting more information. Thank you.
Thank you.
Yeah.
Thanks.
And I saw someone else, I believe, with a comment. Rosalie?
Rosalie Austin, City of Holland. I wanted to listen to Denise Maiton. She had her hand raised in the first public comment, but we have Denise Newhouse too. But I have a lot to say. I'm happy about Delbert Cortez providing nutrition education to adult foster care, especially specialized residential. That's been long overdue, and on the CMH Facebook page, there is a registered dietitian. Is Dale Bird Cortez a registered dietitian? Will she be training, teaching both people, the homes and the public that can go to the CMH lobby for nutrition and healthy eating? And if not, I think it's important to remember that some people with severe needs need a safe eating plan with the dysphagia. And it is an important thing, and I'm glad to see it finally addressed. And I would like to see the contracts in their entirety in the packet to see the unit rates so we can, as self-directed services people, compare rates, kind of do some value-based purchasing. And it should be public knowledge what we're paying for all these contracts. I thank Stephen for bringing that up. And other counties do have a rate schedule of their service providers. That Kent County is one of them. Ottawa doesn't. It's average, pretty much negotiated individually, which brings to the level of care for like self-directed service people that I'm glad to see all these specialized residentials come under contract, but that's not the only option. People have choices, home and community-based services. They have the option of choice to live in their own home with adequate supports. And I don't want us to forget that option. Thank you.
Thank you. Anyone else in the room before we go to anyone on the phone? Okay, Patricia, are you finding Denise?
I'm here. Can you hear me?
Yes.
I just sent Gretchen Cosby something that might help. I've worked with Steelcase, Herman Miller, Bissell, including Stryker as a contractor, and RFI is gathering information. It's a big part of a funnel. It's what do we want to prioritize? And then it goes into RFP as far as the board or whoever oversees it says, yep, you know what, let's go from ideas to concepts, mock something up. Anyway, that's just that. My biggest thing that I want to talk about is in self-directing, the financial management services or the FMSs. I guess I'd like to know who oversees them, who guides them, who trains them. In my discussion with other families, they're all contractually different. They tend to blame the agency of community mental health. Community mental health usually tends to go back and say they're not doing something right. I don't know who's overseeing them, but they definitely need to have an audit themselves. I was just told that our HAB waiver is at risk of losing because we were unable to hire a CLS worker. And now we are being penalized for that as almost losing our HAB waiver. I had no idea. I was completely shocked. I think our fiduciary probably dropped the ball. CMH thought I knew this. I don't see how we can be penalized for The same struggle that CMH is having to fill positions, our families are having time. You know, I could hire respite. And the last thing I just want to talk about is that, yes, please keep talking about the severely disabled IDD community. The mild to moderate, I do think have opportunities. As my son reaches 26 and is going to be leaving Ottawa Area Center, the transition is meek. I will need to have CLS providers to get him out of the home. With Can Do being dissolved, there is, as we talk about a gap, there's a black hole for the non-vocational severe population who is obtaining a HAB waiver, so they have the money coming in. There is a huge zero lack if we don't have the ability to have one-on-one care or two-on-one for some of these. And so I just want to make note that our metrics and the trackable measurables that you're thinking about, please continue to put the most severe in that placement, especially with the housing. There might be some housing available, but it is not where you can put a camera overnight on some of these individuals that have such severe seizures or they're nonverbal, you know.
All right. Thank you. If there are no other comments, can I just ask about that? Because that's really concerning, the HAB waiver. So, and I don't know how we address this, but not having a CLS worker, the penalty would be to lose the waiver?
I will have to go back and talk to our staff about that. So I don't know the specifics, but I was planning on following up.
Yeah, because that's the most severe.
did we get her
Waiver
name
is
and-
non-vocational, correct?
Can you please share your full name for us so that we've got that so I can do some follow-up, Denise?
My son's name is Ashton.
Oh, we don't need your
And-
son's, Denise, just yours for the public comment.
Denise Mites, and that's spelled MEITZ.
Thank you, Denise.
All right. Any other public comment online, Patricia? No hands up? And then I would like a motion to adjourn.
Can I make a comment to Denise a second? Because my heart today, my heart is just really pulling for Denise Newhouse and Denise Mites because I know both of them. I've met Denise's daughter many times. I met Denise Mites' son maybe once or twice. The worst thing that the OASD did last year was to vote that 1 week per month to be closed. Because I follow those parents on Facebook and they have talk about day care. They don't have options to find people to take care of that severely disabled child. What in the world were they thinking to close school a week? I can't even fathom that. Like, I know what it takes for me to get here with my son, and he is that mild to moderate. And I'm blessed I can leave him alone to come to work or come to this meeting, but they don't have those options. And so the OASD made that decision, just blew my mind. So Denise Mites, if you're listening, again, I'm so sorry. They don't have options for care, and there isn't respite care. I'm not pointing to you because they're just not care.
Like to know too, and I don't know how we capture this data because, it's like making that transition. And I think about Can Do and then how your organization, I think, was a stopgap where the community didn't feel. You came into fruition around the same time Can Do was disbanded or,
A little earlier, but
a
yeah.
little bit earlier. So you kind of filled that void. But in this case with OAISD making the decision because of lack of CLS workers is what I understand, or support, it got pushed out into the community. So I'm wondering how many parents gave up? How many parents then look for adult foster care or other, like group home options rather than trying to manage at home? Where, it's like, I think research indicates is the best place for,
Yeah.
the family member to be,
Well,
what was the community impact of that decision, I think needs to be measured.
And for those parents who do have jobs, what employer is going to let you take a week off per month? And then when you really do need to take a week off to go on a vacation or something,
Yeah.
you need another week off? Like, how did,
And it's 2 weeks, right? In like June and July or July and August.
I don't know, but I think this past week was one of those weeks because again, I see the Facebook tower, like, what am I going to do? I don't have anybody. It's just crazy. There just isn't enough workers and helpers. And then to expect parents to find somebody when we can't find staff, where do you think they're gonna come from?
The taxpayers are thinking that they're paying for services to help this, and it's not, and I'm not pointing at CMH, it's just
No.
like these decisions that get made even outside of CMH or a
Yeah.
little bit, partnered
going
with.
Yeah, that's not a,
Yeah, I
No,
know.
that's
Then
Then it ends up falling out.
It's just a bigger picture of the problem.
Yeah,
That's all I'm
right.
saying.
How that decision flow
Yeah.
ends up, impacting the community. Yeah.
I'd like to follow up on what Denise was saying, that it even this frustration goes beyond just trying to find staffing, fitting with this halfway in this 24/7. It finds out, you find yourself in a struggle, a negotiation just to get a budget built into your IPOS, just based on what you've identified in your own weekly calendar about various activities and needs you want to fill in for your kid. And then you're confronted with, well, before we can approve that, how many people have you hired? And a lot of times it seems like you're struggling with putting the cart in front of the horse. I mean, it's impossible to, make a budget, I think, built around how many people you think you're gonna hire or have hired. It has to be just focused on what the needs are. It's just like, any business, when they go to the bank, get a loan to start up their business, they're not gonna be held account to, well, how many people have you hired to run this business? And it's like, well, let's put the cart in front of the horse. We need the money first before you can go forward. So when having an IPO's budget, you need to know ahead of time that you've got that budget and then the comfort of going forward that and being able to hire people because you know that you can then pay them and not have to go back and renegotiate your budget in order to cover people as you are hiring them. And so I can appreciate, what Denise is saying about feeling penalized. I mean, here we are at CMH and all the time we're talking about the difficulty of staffing. And I have not heard any discussion about the CMH's budget being held hostage to how many people it can hire or has hired. I mean, the budget stays the same. And that should be the same thing for people who are needing to hire CLS workers. Start out with their budget. Don't hold it hostage to how many people you've hired or you think you can hire. I mean, the idea is you're working down the road to achieve that goal. And you have the backup of knowing you have the funding to do it. So I guess I'm just expanding. I think it's a broader issue even.
Yeah, that's what I was just gonna say, Stephen. There are so many things that really are way beyond the scope of what we as a board, I think we can acknowledge how these all play into the needs. But so far beyond the scope of our decision making. And I think the first step is probably putting things out there to raise awareness. The HAB waiver, for example, the criteria is in place that has nothing to do with decisions that we make. So it's frustrating, I understand, and I can appreciate the frustration that parents go through too. Hopefully, as we gain more information, we'll be able to continue to support the families and parents in the best ways possible as we get more information about the HAB waiver, about CCBHC.
And we need to get that information, and we are the policy-making board, the CMH. So we have that authority. We just maybe need to evaluate what direction we want the CMH to go, and what policies it will adopt to accommodate the people in our community.
Okay. Help fund solutions. Help
Right,
you with
right.
solutions,
Right.
because it can be it's like the complaint session and it's good. I mean, it's good to get the information in, but getting it in, what do you do with it from there? And I think that's what I
Exactly.
hear, it's like, how do we help? How do we help? Given our capacity. Is there a motion to adjourn? Yes.
Support.
Moved and supported. All in favor, please say aye.
Aye.
And opposed. Thank you. Our meeting's adjourned. See you. Take care.